Chairman of Dr. Iwang Yusuf, and the Honorable Speaker, Professor Sarif Kaf Al-Ghazal, and respectable members of FOKI, and also ladies and gentlemen who join this webinar. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon you, and may also praise to Allah that we, Alhamdulillah, can start this webinar with the FOKI session for first session of our webinar series of activities. And before we start, we first reading together Basmalah. Yeah. Bismillahirrahmanirrahim. Yeah. Thank you for all participants who have joined this first from 5 sessions of FOKI webinar. Maybe you have also seen the flyer for the next sessions of our webinar. This webinar is actually a final event is in the FOKI conference that will be held in the December 2024. My name is Fika Kayanti. I'm from Faculty of Medicine, State Islamic University of Syarif Hidayatullah Jakarta. And this session, only one session that discuss about the history of medical teaching by Muslim physicians, the history of medical teaching in the Islamic civilization. That our speaker is Prof. Sarif Kaf Al-Ghazal. And because Prof. Sarif has already shared the presentation, I will read his biography. This session, we asked Dr. Prof. Sarif to give the lecture. He is an executive member of Federation of Islamic Medical Association, FIMA, and he is also FIMA History of Islamic Medicine Project Lead, which was established in 2022. He also the founders of British Islamic Medical Association, and also the editor-in-chief of Journal of BIMA, British Islamic Medical Association. And after this session, Prof will also give us the link to submit when you have interest to submit in JBIMA. And also he is significant. He has significant interest in history of Islamic medicine and has published several articles on this topic. And he also have created a book about the Islamic medicine, the miracle of medical medicine. Yeah. And also Prof. Sarif also elected as a chairman of board of 1001 Cures Ltd. This is a new organization owned by FSTC. I think that's the Professor Sarif curriculum vitae. And to next session, I will give Prof. Sarif to share about the theme that we have now, the history of medical teaching in Islamic civilization. Please, sir.
جزاك الله خير. السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد خاتم الأنبياء والمرسلين. جزاك الله خير, sister, and many thanks to the Indonesian Islamic Medical Association for inviting me for this talk. As you can see, I wear a few different hats, but today I'm just going to probably maybe share with you some slides, information about our great history of medicine in general. Yes, I'm a plastic surgeon by background. I'm working in the UK for the last probably maybe over 30 years. And I've been developing lots of interest on the history of Islamic medicine. So why we do talk about the history of Islamic medicine in general? Because if we can see this, I don't know, I hope the slide is moving now,
Yes,
sister.
yes.
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 So if you look at this book, it's called, although it's called The Short History of Medicine, 600 pages on the history of medicine, talking about the Muslims and the Islamic medical history is only hardly 6 lines, only 6 lines. And also another book, which is one of the famous book in surgery called Principles of Surgery for Schwartz. They talk about an example of surgical procedures, ligation. They jump from Galen to Paris, which is over 1,500 years, jumping over Al-Zahrawi without mentioning at all what happened with a great physician called Al-Zahrawi. Also, when we see the pulmonary circulations discoveries being given to William Harvey without even giving any accreditation till only recently, last few years, people start talking about Ibn Nafis. Because of this, I thought it would be great to focus, to see our history, because if we don't learn our history, it will be really shame. We cannot repeat this great achievement. We can't learn from this achievement. So this is how, unfortunately, some of the institutions in the West, this is how they like to present our history as almost 1,000 years, nothing going on between 600 AD to almost 1,600. So 10 centuries, almost there's nothing. Yes, we all know that Europe used to live in dark ages, but there's lots of shining areas in the world, and we're going to discover this. So I choose to talk on medical teaching and Islamic civilization, and we're going to discuss many points. We're going to touch on the general health advices being given in Quran and Sunnah, and also how this medical development started with the Islamic civilization through the translation movement, and then the contribution of the state, then talking about the hospitals, which are called actually Bimarstans in the history of Islamic medicine, and then how they license a physician to practice medicine. Then probably touching on different examples on the medical history, and also touching also on the medical Islamic medical ethics and health education to the public, and how the Islamic medicine influenced the many generations in Europe. So let's start, inshallah. We all know there's a lots of points, lots of hadith being mentioned on general health advices by Prophet Muhammad indicting, for example, the hadith, very famous hadith, ما ملأ ابن آدم وعاء شرا ببطنه. A person doesn't fill a container worse than his stomach, and all the advice always given: one third of stomach for the food, one third for the drink, and one third for breath. This is to show how important is the eating and the type, quality, and the quantity of eating. Also in the ayah Surah Al-A'raf, وَكُلُوا وَاشْرَبُوا وَلَا تُسْرِفُوا, eat and drink but not excessively. Also some advices on drinking, and we all know alcohol drinks is haram. On public health in general, the plague, on Al-Ta'un, we all knew what happened during the COVID-19, and the great advice we can see from one of the hadiths: if you have the plague in some places, and you are planning to go there, so don't enter this area. And but if you are already there, don't leave. So this is the very basic principle of isolation, and this is a great example of one of the hadiths on this area. Also, seeking treatment is very important. Allah subhanahu wa ta'ala never created any disease without also creating the cure for it. Whoever knows it, he knows it, and whoever is ignorant of it is ignorant. ما أنزل الله من داء إلا وأنزل له دواء. This is itself, it's an invitation to learn about the cure, to search about treatment. Also, many other things being mentioned about using honey and the black seed and hijama in treatment, and also the miswak. So this is just only few points, and we knew this from Al-Tibb al-Nabawi, lots of hadiths being collected, and as the sister mentioned, there is medical miracles reflection in the Quran. Yes, the Quran is a book for guidance, but there is still reflection as a way of ijaz. The second point I'm going to probably maybe start here is the translation movement, how the Muslims actually started, because the Muslims tried to preserve and keep the Greek and the Roman civilizations through the translation into the Arabic language. And this is how the Bayt al-Hikmah started. Bayt al-Hikmah was almost like, it was built in Baghdad during the Abbasi time. It was like intellectual powerhouse, intellectual college, all type of scientific specialties, lots of physicians and scientists try to obviously translate and explore books and collect it in one place. This is all done by the Arabic language, because the Arabic was the language of science at that time, and lots of words being taken from that language. One of the director or chief of the translation was Hunayn ibn Ishaq, who translated many books from Greek. And without this translation, all these books would be completely lost. The Greek civilization will be completely lost without having this preserved. But we need to remember this translation. It's not just only the Muslim physician, not just only translated and took it for granted. They've added lots of things on, like the idea was to develop the we talk about here the lots of observation and experiments. The books being written in a very different way from the Greek. So we had the chapters, we had articles, classifications. The Arabs put the references as well. Also, the Muslims produced the specialty of pharmacy. Pharmacies being as a separate entity. Also, regulation of medicine, and this is what we called al-husba, meaning there is monitoring service, regulation service. Also, the prophylactic medicine, as we mentioned before, was introduced. There is a places to have the treatment, proper places called Bimar stands. This is the hospitals to give the treatment, and this is a new, obviously. And the surgery, lots of development in surgery by Muslims, and the surgical instruments being introduced. And there's also many criticism to Galen, to Jalinos, to Galen himself, by different physicians, Al-Baghdadi, Al-Zahrawi, Ibn al-Nafis, and Al-Razi, and lots of others who criticize Galen in different areas. And this is one of the example book for Al-Razi, who started the book, yes, given and talk about Al-Razi in a very nice, dignified way, Al-Fadil and Nabil Jalinos, but again, he nicely criticized him in a different areas in his book, in this book, Food and Dieting. The other point I'm going to touch very quickly, the contribution of the state. The state, especially during the Umayyad and the Abbasi time, gave quite a lot to building hospitals, even one of the Umayyad princes, Khalid ibn Yazid, he in fact, he gave up his treasure just for the sake of studying medicine, and went to study medicine and chemistry in Alexandria. The Abbasi Caliph caliphs used to reward the weight of translated book by gold. This is encouraging the people to come and translate and be free to give their time, give their effort for developing the medical science. And also not just only encouragement. There's the finance. We know the waqf part of the waqf used to be given to build not just only hospital, not just only mosque and schools, but also hospitals, and looking after the poor people. Part of zakah as well, which we all know 2.5% can be also directed towards building hospitals. Harun al-Rashid asked al-Razi himself to build one of the first hospital in Baghdad. So al-Razi tried to select the best place in Baghdad, and to know the best place, he had to put a few pieces of meat in different areas in the city to check the least of them will be spoiled. So that means a fresh air and a proper place to build the hospital, and he recruits many physicians with him to start in the hospital. The Bimaristan, the hospitals, when we talk about Bimaristan, it's a great achievement in the history of Islamic medicine. This is where the place of medical teaching started. Anyway, so I'm just probably going to very quickly touch on some example during the Prophet Muhammad ﷺ time. We know during Al-Khandaq battle, the Rufaidah, she was the first female to do nursing, and she was the medical care provider and helping the injured people. In 700, Al-Walid, during the Umayyad time, he built a hospital for patients with leprosy. Leprosy, in fact, Judham, leprosy in Europe, patients used to be burned to death by royal decree. But in the Muslim world, they used to be treated in hospitals, as we knew from the Umayyan time. Al-Razi built the first general hospital in Baghdad, as we mentioned, and there is many great, I wouldn't call it hospital, it's a big medical centers. There's over 34 of these big medical centers over the Islamic areas, and we're going to touch on probably maybe one of them, called Bimaristan al-Mansuri, built in 1248, and this is one of the largest one. It's 8,000 beds. When I mentioned this figure, I try to make it easier for you. I mean, one of the big hospitals here in Jakarta in Indonesia is the RSCM, which is probably maybe it's one of the big hospitals. It's just over 1,000 beds. So when we talk on Bimaristan al-Mansuri, 8,000 beds with a specialized ward, medicine, surgery, fractures, eye diseases, free admissions regardless race or color or religions. Everybody is actually welcome from different faiths. Also, the physicians are from different faiths, Christian, Jews, as well as Muslims, obviously. Medical schools attached to the hospitals in Al-Mansuri Hospital, the library to teach the medical student and the junior doctors. There's halls for the meetings, housing for students. And Ibn Nafis, who was the chief physician in Damascus, he was the dean in Bimaristan and Nuri. He moved to this Bimaristan in Egypt, in Cairo, and he took the job as a chief physician as well. And then there's a lady called Bint Shihab al-Din ibn Sayr. She was one of the female first physician and the chief of physicians in Al Mansouri. This can give you how great females actually reached during our history, mashallah. We're going to mention this later on also. We should mention here, there's the patient-centered care. So there's no limitation for hospital staying. Patients can stay as long as they're fit enough. And they used to say when they are able to eat full chicken, obviously probably maybe small chicken, but this is how the way they used to treat. There's no pressure. There's no pressure from beds, from the management, from the finance, from the resources, as we are unfortunately facing in the West nowadays. But just not only giving full time for the patients to recover, they also give them sick allowance and little pocket money as a social care. There's separate wards in the hospital for male, female. There's a proper records of the patient. There's a mosque and the chapels. There's running water when Europe had no running water, and we all know this. And unfortunately, Europe was in a very dark ages that time. So this is a Bimaristan Al Mansouri in Cairo. I mean, lots of articles being mention the accreditation for a hospital in the history of Islamic medicine, and this is Prof. Emily Savage Smith in an article and book she published. In Damascus, as we mentioned, Bimaristan Al Nouri was built in year 1154. It was great. When we read about Ibn Nafis, who graduated from this. Another Bimaristan, this is for mental health in Aleppo, and the mental health, this is Bimaristan Argon al-Kamili, which, I mean, this photo is being taken in 2005. Unfortunately, this Bimaristan was destroyed by the barrel bombs in Syria, and this is photos from 2015. Lots of other Bimaristan. We're going to probably maybe touch on licensing physician, how they licenses. Special trainings being given, as we mentioned, Al-Muqtadar during the Abbasi Khalifa used to ask Sinan ibn Thabit, one of the senior physicians, to screen all the junior doctors, junior physician, and this is what they did before they practiced. Al-Razi used to examine the student by
Sir, you are muted.
Can you hear me?
Please continue.
Sorry.
Yeah.
So as we mentioned here, the senior physician like Sinan bin Thabit used to screen the physician to make sure they are fit to practice, and there is different ways. One way is actually the ijaza. Ijaza means to practice, to give the certificate to practice, and this is one example in Morocco and in Fas, and not only need to have three senior people, has to be authorized by three senior physicians to recommend this new doctors to practice, but they also need to have 15 well-known, respected people, wujaha al-qawm, so they can say this person is a quite good manner, is a quite good ethics, and he's been attending Salatul Jama'ah, he's been known to be in a good manners. So it need to be recommended by many other people before they've been given the license to practice. And this is quite interesting when we talk about diversity and equality. In Muslim world, not just only Muslims like physician, as we probably maybe know, Al-Razi, Al-Zahrawi, Ibn Sina, Ibn Nafis, Al-Idrisi, but they're all Muslims. But there is other, like a Christian, Hanin ibn Ishaq, Yahya ibn Ishaq, there is Ibn al-Quf, there's Christian, and there's Jews as well who have been part of this Muslim civilization. Ibn Rahman, Yaqub ibn Ishaq, and Maymun ibn Maymun, Musa ibn Maymun. This is to show how tolerant was the Muslim civilization towards other people from different faiths. And not just only this, I want to make sure the females being given great, excuse me, great positions during Muslim, early Muslim stages on the medical side. Rufayda al-Islamiyya, as we mentioned before, she was the first nurse and medical aid provider during the battles and Khandaq, during Khandaq battle. Also, Al-Shifa, Layla bint Abdullah al-Adawiyya, she was appointed by Sayyidina Umar ibn al-Khattab as the lady in charge of Al-Husba. Al-Husba in that time used to be almost like health and safety officer in the market, to try to inspect and make sure everything's being regulated and being done on the right way. See, we can say probably she's the first Muslim woman to hold such public office in this way. So Al-Shifa, she was one of them. Atiyya al-Ansariya as well, one of the Sahaba. Zainab bint Aud during the Umayyad time. Al-Hasan bint al-Qadi Abi Ja'far as well. She practiced medicine. Al-Zahrawi himself, he had his daughters and granddaughters. They practice medicine. And there is probably over 35, 37. I've collected them in an article published few years ago in the JBIMA. If somebody wants to go through it, will be very welcome. Why we're mentioning this? Because Muslims, lady, they're not only on the first rows, on the first seat to attend lectures, but only being on the giving side. They've been teaching others as well. And we can see here, Bint Shihab al-Din ibn Sayyid, she was the chief physician in the Mansouri Bimarstan. And also, we should mention that Fatima al-Fahriya, she was the first, she was the lady who established the first university in the world, the university in Morocco, in Fas, called al-Qarawiyyin University. I'm not saying this, it is actually UNESCO website, and you can see it's quite well accredited that al-Qarawiyyin was founded in the 9th centuries as the first university, oldest university in the world. Why we're mentioning this? Because if you look at in the West, Elizabeth Blackwell, the American physician, she only can practice in England, and being given in 1858 the license to practice. Also, Elizabeth Anderson, the English lady, she practiced in England after she had to go to France because she was barred. She was denied to finish her training in England as discriminating against her being a lady. The first surgeon was just over 100 years, Eleanor Davis Coley. In 1911, she was the first female surgeon registered in the Royal College of Surgeons. This is how actually to show the status of our female sisters in the history of Islam. Now we're going to touch very quickly on one example on pioneering research. Ibn Nafis probably maybe one good example. Ibn Nafis, in fact, he, as I mentioned, he moved from Damascus, from Al-Nuri Bimarstan to work in Cairo, and he became the chief physician. He was also the ustad in the Fiqh Shafi'i, in the Madrasa Shafi'iyya in Cairo. And he wrote a huge book called Al-Shamil fi Tibb, The Complete of Medicine. But he also wrote very interesting book discussing and explaining, commenting on the anatomy of Ibn Sina book, Al-Qanun, and he had lots of things on anatomy, and also he slightly had different views from Ibn Nafis, and he discovered the pulmonary circulation, and this came by coincidence when one of the Egyptian PhD student went to Germany in Frankfurt, Dr. Muhyiddin At-Tatawi, and he was doing his PhD in 1924 to take his PhD, and found this manuscript of Ibn Nafis, and he studied this and he published it, and he proved that in fact Ibn Nafis was the first who described the pulmonary circulation. And he obviously Ibn Nafis, he criticized Galen, and he mentioned there's no holes between the two main chambers, between the right and the left part of the heart when the blood actually moved, and described the how the blood leaves the heart to the lung and mixed with the air to get back to the left side of the heart. This is how the pulmonary circulation. Not just only this, he discovered the coronary arteries, and he was the first to mention that the blood supply to the heart muscle is provided by small vessels, not just only, as Galen said, it would just come by itself because the blood's already in the heart, so the muscle gets blood from the heart. No, the Ibn Nafis, he was the first to in fact describe the coronary arteries, which was great. This is after lots of effort and anatomy and dissection and research. So Ibn Nafis, he was definitely the one who take the credit for describing the pulmonary circulation over 300 years before William Harvey. I'm going to probably maybe mention now one of the clinical teacher, as we talk about teaching, medical teaching. So it would be great to touch on one example, and I'll take probably maybe Al-Zahrawi. I like Al-Zahrawi, and he's very known in the West by Al-Buqasis. Why Al-Buqasis? Because his name is Abul Qasim Al-Zahrawi. So Abul Qasim became Al-Buqasis. But this is the name in the West. We still call him Al-Zahrawi. Very proud to call him Al-Zahrawi. I like him maybe because he's a surgeon like myself. I'm a surgeon, and he was born, brought up, and died in Europe as well. So he's part of Andalusia, in a little town called Al-Zahra, a few miles away from Cordoba. Cordoba is a beautiful city, and this is where he used to live, in a little town, a little street called Calle Albucasis. If you get the chance to visit Cordoba, you'll find this, and his house is completely deserted. Number 6, and this is Cordoba. It's a beautiful place. Used to be even more beautiful when the big mosque of Cordoba used to shine. Used to be almost like university, accepting all students from everywhere in Europe. The library, over 500,000 books in Cordoba. People, the rich people from Europe, kings from Europe, used to send their children to learn science and definitely medicine also. This King Offa of England, in fact, he copied the Muslim dinars, and you can see La ilaha illallah on the currency, the English currency that time. People thought that he's probably maybe became Muslim. I don't think he was, but this is to try to copy the victorious, the great people in Andalusia, great country, many shining city, Cordoba, Eshbilia, Granada, and it's a great to get a chance to visit this part of Andalusia. So Al-Zahrawi brought up here. He wrote a fantastic book called Al-Tasrif Liman Ajiza An Al-Ta'lif, the method of medicine for who cannot write a book. So get everything in this book, 30 volumes. well, I think it's too much to talk about the whole volumes. We're going to touch only on the last volume. So volume number 30, which is the volume of surgery. And I'm just going to probably maybe go through it very quickly. Volume of surgery, the last volume, number 30, has over 188 chapters. And he described over 200 illustrations. Al-Zahrawi. On the right side, you can see the manuscript of Al-Zahrawi in Arabic. And he started with putting lots of emphasis on studying anatomy. You need to study anatomy before you start surgery. This is quite important. He talked on general surgery as a subspecialty and how you stitch the abdomen, how to do a laparotomy. And he had the different ways of doing things from Galen. He agreed with Galen a couple of techniques, but again, he had his own ways. And he described the Trendelenburg position even over 800 years before Trendelenburg himself described it. He described how you can close the intestines by using the ant's head. So he put the ant's head, and the ants will bite and then cut the head. And this is very much like biological material will drop off after a few days. And he described creating or making thread from the sheep intestine, and they call it. We still use it. We call it plain catgut. The catgut is actually first described by Al-Zahrawi over 1,000 years, and is still being used, and the accreditation being given, obviously, to Al-Zahrawi, as you can see here in a book for Fred Raymond. Al-Zahrawi made the first innovation of using silk as well catgut from the intestines of sheep. He also, on general surgery, he described the umbilical hernia, the hydrocele, and also the inguinal hernia and how the operation is done. He also described the hemorrhoids, the piles, and distinguished between the internal and the external one in a great details, very similar to what we know nowadays. The thyroid and the thyroidectomy, how to operate on the thyroid. In fact, he was probably maybe the first to describe successful thyroidectomy. It's not me, I'm saying this is actually written and published in the International Surgery Journal. As you can see here, Albucasis was the first to give the opium as well for sedation and describe successful thyroidectomy. Pediatric surgery, he described the hypospadias and talk on the ways to do it, imperforated anus as well, and obviously the circumcision for young children and how to give them the sedation. Urology, he described in details how to create a little catheter and also to irrigate the bladder and to treat the stones in a great details. Fantastic. This is a great quotation talking about the Al-Zahrawi in the field of urology and how he removed the stones. The trauma orthopedic surgery, Al-Zahrawi himself, he advised to reduce the dislocation very quickly. If you don't do this, the swelling will prevent it from reduction. So it's very important, as he mentioned in his book. Also, he described using splintage for hand fractures, and it's good to start with the partial splint and then put full splint later on to avoid compartment syndrome. He described the malunion and ununion of the fractures, and he made with a team. He had a full team to make his instrument, and he advised him how to make the instrument and use the right material for the right purpose, to fit the purpose. a great surgeon with a great mind. And this is actually part of the instrument he used. Rib fracture, he likes the surgical way, and he criticized Galen Galen used to say, just feed the person with some food which can create gas, and the gas will push the broken rib out. Obviously, this is not the right way, and Al-Zahrawi criticized this. Plastic surgery, believe or not, he had a few principles on plastic surgery, and he mentioned that you cannot just you can't just stitch wound without cleaning it. You can't stitch infected wound. You have to debride it, you have to clean it, and then you stitch it. And also, he described the cleft lip and the way to be treated. Also, the polydactyly and syndactyly. Polydactyly when you have extra fingers, or syndactyly when the two fingers actually are attached, and the way to separate them. And the eyelid surgery, which is part of what some plastic surgeons they do, ectropion. Ectropion using the same technique we still use till now. Great surgeon. Also, gynecomastia, which is the enlarged breast in the males, and he described the technique using the C-shaped technique, which still being used nowadays. Cancer surgery is quite interesting when he described the breast cancer as well as thigh cancer, سرطان الثدي وسرطان الفخذ, and he put a few principles. One of them, you have to do wider excision. You have to go around the tumor to excite. Not just only this, he said if the tumor is too large, if it's advanced, you should not touch it, because I could not do it. I could not cure. In fact, you can make things worse. Vascular surgeon, he described the aneurysm when the venous and the arterial blood connected, and this is in chapter 49. In his book is mentioned this, and this is taken, obviously, William Hunter, one of the great surgeons in the Middle Age, mentioned this and make referral to Al-Zahrawi. As you can see here, William Hunter research aneurysm began of article published in 1763, and the manuscript was Al-Bukhasis du Chirurgie in the chapter 49. Is a great surgeon, even in ENT. ENT as a part of surgical specialty. He described how the tonsillectomy is done. He also described the instrument like a tongue depressor as well, and put case report. And as you can see, many books. One of the books, Children's Surgery, give credits to Al-Bukhasis, to Al-Zahrawi on the tonsil guillotine machine, and he described how tracheostomy can be done and his observation on this. Eye surgery, would you believe, even he practiced eye surgery, and he described how the cataract is done and removing it by special technique. He also, another technique, which is the aspiration, used to be practiced in Mosul in Iraq, and he said, I've heard people doing it in Iraq, this different technique. And in fact, if you go and study what Ammar bin Ali al-Musri al-Kahal, he wrote on that technique by sucking the lens rather than just push it inside the inner eye. And it's quite interesting, even this being given to him, this credited to Al-Zahrawi, this book, Cambridge History of Medicine, published in 2006. You can see here the techniques invented the treatment of cataract of eye. Obstetric gynecology as well. Al-Zahrawi, he wrote on normal delivery, how to teach midwives to do the normal delivery and what things they need to be aware of. And he mentioned the vulture position as well. And not just only this, and you can see it's one of the biggest chapter in his book, being given like 10 parts or 10 chapters of the books for obstetrics, and this is being supported by Monica Green in her book and talk about Al-Buqasis Al-Zahrawi. He also described how to remove dead fetus, because it's very dangerous to leave dead fetus. So you have to remove it, otherwise there'll be bad infection and the pregnant lady will die. So he described two main instruments, one called al-mishdakh, and the other one is the forceps, al-milqat, can be tooth or non-tooth, and describe this. And obviously Helen King in her book also mentioned this. As you can see, Al-Buqasis mentioned the two forceps as well as al-mishdakh. It's interesting when you read that the first one who described the ectopic pregnancy was Al-Zahrawi, and this is very well known. Ectopic pregnancy, when the pregnancy happens outside the womb, and Al-Zahrawi described in the full great details, as you can see on the Arabic manuscript on the right side of his book Al-Tasrif, and this has been written, also supported by a book by Kenning and Shuhaib. Al-Zahrawi talk about dentistry and dental surgery, wiring loose teeth, also fractures of the jaws, also replacing a little missing tooth by having a small bone taken from the cow bones, and many articles mention about Al-Zahrawi and tooth replantation and his advancement in dentistry. And this is actually one of the chapters, chapter 30 on this is manuscript kept, by the way, in the library in Oxford in Britain, and talking about dentistry. Neurosurgery, would you believe somebody 1,000 years ago even practiced and taught on neurosurgery? Yes, he described how to open the skull by having they call it al-mithqab, 2 holes, and then adding another hole, 3 holes, and try to cut in between and remove the piece of bone. This is what we call it craniotomy, which is still being used as a technique nowadays. A great surgeon. Al-Zahrawi is being mentioned in the book by Louis Becquet, The Neurosurgeons of the Past. But he's got some observation of malpractice, because he used to get lots of cases from different areas in Cordoba, and he used to teach his student, be careful, as we mentioned, because somebody removed the tumor when you cannot remove it, and the cause death. Obviously, when you tie too much the splint around the broken leg, and you might cause compartment syndrome and gangrene. Also, operations might lead to death. He gave his great principle to his student, and this principle is not just only to know how to operate or when to operate, but you need to know when not to operate, because sometimes operation might cause more damage. Instrument, he talked about instrument in details. Some of the instruments being published in or maybe replicated in Cordoba, a little museum in Cordoba, and some of them being some of them done in Aleppo, in Syria. This is back to 2006. It's a great collection in Morocco, being produced in 2016. But there's a better one I've seen in Fas in Morocco in 2018, and one of the great collection of the instrument of Al-Zahrawi being replicated, being reproduced, done by Fuad Siskin, also in Frankfurt, and a great instrument. So you can see this is how Al-Zahrawi's instrument, almost a state of the art, very similar, 1,000 years later, similar to what we know nowadays. Al-Zahrawi is teaching hijama to his student. Al-Zahrawi is really many articles. I published few in different occasions, and there's a few seminars and webinars on Al-Zahrawi because of millennium death in 2013. So really the factors made Al-Zahrawi a good teacher. He had extensive surgical experience, how to operate and how not to operate. Al-Zahrawi, he had a great practical teaching and training to his student. The clinical demonstration, observation, bedside manner, bedside teaching, a great surgeon, giving lectures, illustrations, using illustrations and using a drawing to the student, how to make it simple. Also, he created one of the great books, Al-Tasrif, we just been talking about it. He emphasized on the issue of anatomy, and also he contributed the surgical techniques and instrument, as we just mentioned. Al-Zahrawi, he described many topical medications, because we are just only mentioned the chapter 30. The first 10 chapters talking about pharmacy and making medications and topical medications to prevent any infection, to prevent any complications, also to speed up the wound healing. And he described some medications for sedation and how to perform the operations, and also his legacy and the influence in Europe. And the history of medicine mentioned very clearly. Al-Zahrawi, he remained the most used textbook, his book, for nearly 500 years in Europe. This is quite clearly mentioned about Al-Zahrawi, Al-Buqasis. And also another book written by Perotta mentioned that Al-Zahrawi's he influenced dentistry, and his work really great influenced dentistry in Europe for many centuries to come. It's a great reference to Al-Zahrawi by one of the American surgeon, John Ratzenberger, in his book published in 2012. And he said Al-Zahrawi wrote one of the most remarkable textbook of all time. And Al-Zahrawi not just only describing, like many other people who probably maybe not practice. Al-Zahrawi, he spent over 50 years, his own experience and his practice as a surgeon, and describe different techniques. It's a great surgeon, fantastic. Now we're going to go back and discuss a little bit more on the ethical side of medical teaching in Islamic civilization. Very quickly, Islamic civilization talk about the great manners taken from Quran and Sunnah. Many physicians, like Al-Razi, one of them actually, I've just put his name here because he wrote a nice book called Akhlaq al-Tabib, Ethics of Physician, and mentioned many manners which every physician need to be like, to be in his, to look after his own health, to be knowledgeable, have a good manners, maintain confidentiality, respect, need to keep the good face in Allah subhanahu wa ta'ala, and obviously using the right treatment. You're not allowed to use dangerous treatment, and make sure you follow up your patient. Firdaus al-Hukma, another book written by Al-Tabari, fantastic book on ethics. Also The Ethics of Physician by Ishaq bin Ali al-Rahawi is a great book. Adab al-Tabib. And Al-Zahrawi himself, as we mentioned about Al-Zahrawi, he put few medical ethics and he said to his student, keep away from anything which may negatively affect your reputation in the life, and also in the hereafter, in the akhirah. It's better for you and increase your remarks and please Allah subhanahu wa ta'ala. Great. So I published few articles on Islamic medical ethics in different time. Health education to public, for the public. Many physicians, not just only teaching medical students or junior doctors, they also put some nice books for the public. And as we can see here, one of them, Al-Razi, he wrote a book, Man la yahduruhu tabib, the medical guide for public, when physician is not available. Somebody lives a bit far away from big cities, so they still need to know how to treat things. The last things I'm going to mention here, the influence in future generations in Europe, how Islamic civilization and medical Islamic civilization really managed to influence. As we mentioned, Al-Tasrif, Al-Zahrawi himself, his book was the main book in Europe, mainly in the university in Italy and France, as mentioned by Gerald of Cremenia. And they translate his book into Latin. And as you can see here, without any doubt, he was the chief of all surgeon. He was a great of all surgeon. Ibn Sina as well, the canon of medicine. He wrote Al-Qanun, canon of medicine. He was one of the main books to study till the 19th centuries. Al-Razi himself, his book Al-Hawi, he was taught in many universities in Europe. And as you can see here, if you had the chance to visit Cambridge University Medical School, you'll see stained glass window. On one of the window, Kitab al-Hawi, and there is Bismillah ar-Rahman ar-Rahim. This is obviously the pictures of Al-Razi as well on this. So plenty of articles being published, even 1946 by the British Medical Journal on how Islam influenced medicine in the West. And there's many books written on the Islamic history. And I like to just to mention and maybe finish here. It's a great quotation when somebody said, Islam was a religion of remarkable tolerance. Islam has been part of Europe for so long. It has contributed so much toward civilization. Islam was part of the past and our present, and it will help to create modern Europe. Who said this? It was actually the current king of the UK, King Charles. He gave this speech when he was a Prince of Wales in 1993. So why we now mention all of this? Because I think we can correct this slide. I put it on the first, wasn't empty 1,000 years. This is wrong. In fact, there's a great civilizations been going on and taught the whole world and influenced Europe for at least 500 years to come on great principles of Muslim civilization. And I like to finish here because only those who remember history can repeat the history or can make history. Jazakumullah khair. Assalamu alaikum wa rahmatullah.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Prof. Sarif, for the comprehensive explanation about the medical history. Actually, most of it, yeah, I didn't know also. Yeah, thank you for the the speech. And I think there are some questions, and also I have one direct message from the participants. Maybe first, the one that raised the hand, Dr. Eko. Please, you
Okay.
can, yeah. Please.
Yes. Thank you, moderator. Very nice presentation, Professor Sarif. I'm Eko Setiawan from Indonesia, Semarang, Indonesia. Yeah. I'm a general surgeon.
MashaAllah.
Yeah. Well, very nice presentation. It's very good insight.
Mm.
I have 2 point of views from your presentation today. The first view is about the writing culture. Our ancestor, like Az-Zahrawi, maybe Ibn Sina, maybe Ibn Rushd, they write everything. And I read from your early presentation, early slide, there are Prophet Muhammad sallallahu alaihi wasallam said, "Ma mala'a adamiyun wi'a syarrun min batnihi." And Ibn Qayyim has written this topic in his Atib an-Nabawi, but didn't explain about how overeating can make can result. There are many diseases, and one of the Nobel Prize in 2016 about fasting and about the danger about the overeating is get by not by Muslim but by Japanese ones, Mr. Asumi, Yoshinori Asumi. Yeah, and I think the writing culture in Islam is very, very useful, especially in the golden age of Islam. And the second point is about curiosity. One of the opponents of curiosity is Taqlid. And Taqlid هو داء هذه الأمة. And the opponent of curiosity is Taqlid over fanatism. And besides Az-Zahrawi, I think the greatest surgeon is also Ibn Rushd. And Ibn Rushd is curious about everything, not only surgery. He is Qadi Qudat in Andalus, and also writes one of the greatest things in fiqh, Bidayatul Mujtahid. One of the greatest one of the greatest write about comparison of mazahib. And this is the golden age of Islam, and the Taqlid bring Europe into the dark age when he punished scholar in church, knows everything, and maybe also Ottoman Empire rise and down. وهكذا في كل زمان ومكان. Thank you, Professor Sarif, for very nice insight.
Okay.
See you.
Barakallah. I cannot agree more with you, Akhi. Very good. I appreciate it. Taqlid is very important to be careful. And this is why I said the Muslim physician, they try, even they criticize Galen, Jalinos. They didn't take everything for granted because they have a brain. They thought about it in details, and they added quite a lot. Jazakallah khair.
Okay, thank you. I think it's also a statement from Dr. Eko that we need to write. Muslim need to have the habit to write all the expertise experience. Yeah. Okay, Professor. There is another question from Dr. Zaki. He asked about why do you think most of Islamic scholars were multi-talented in many fields, Professor?
Can you get Dr. Zaki? Nice if he has any.
Dr. Zaki, can you
Dr.
ask
Zaki, feel free, please.
yourself? Feel free to ask.
Feel free.
Hello, Dr. Zaki. Maybe he has something to do. Maybe you can answer first. Yeah. Maybe you can explain first before he showed up.
Dr. Zaki, feel free to unmute yourself, and if he wants to make any comments, make any. MashaAllah.
Yeah, I think Dr. Zaki, yeah. Okay. You can ask yourself.
I'm sorry, Professor, I'm still in the way to my office now. Yes, like I have said before in the chat questions, it is in my interest that most of our Islamic scholars were they are polyglot, they are multi-talented. Is it something that difference between the old ways educations compare with present education that we certain to be very specialized, even sub-specialized, compare with our scholars that were multi-talented in many fields of medicine, like Al-Zahrawi. They made he made a lot of surgical device, but not in only one field, but many fields. Maybe you
Also
can
dentistry, yeah.
explain us, Professor.
Mhm. Yes, Professor.
I mean, you've just mentioned it yourself, obviously. These people, talented people, akhi, we're just standing on the shoulder of the giants. And this is great scholars, great physician, great figures. But that's not impossible to repeat it. Inshallah, when we have a new generation, they've been taught on the way this old generation's been done in a very open way. And as Dr. Eko said, actually, we need to avoid the taqleed in itself in a bad way, not in a good way, because obviously take the good lessons and make taqleed how you can repeat the history. As I mentioned, if we don't learn the history, we can't make it again. We need to take lessons. We are not taking lessons. Unfortunately, as you see in the Muslim Ummah, whatever it is, look at what happened in the Muslim world. Unfortunately, we are struggling. We are in the below the poverty lines. We've been even look at the most refugees in the world coming from the Muslim world. Look at the most struggling people. Look at what happened in Gaza. Subhanallah, and all the Muslims actually just watching it and cannot do anything, which is quite sad. Our status, our condition is really is quite difficult. I mean, you can cry for this, but we need to have a new generation who would probably maybe bring back the energy as it was before. When young people like Muhammad al-Fatih, he did what he did, like this giants in science. I concentrate on a few examples in medicine today. It's not impossible to repeat it. Yes, there's a subspecialties of subspecialties, which is fine, but we need to have the mubdi'een, the people who really produce great quality and great fantastic discovery of things. We should have this, inshallah, great effort. It should bring it, but we need to have the free mind. We need to have the people have the intellectual and the freedom to do things and to allow for them to do.
Yeah, and I think also one more Professor, we have to unite, right?
Of course, yeah. This is what I'm
Yeah.
saying. This is the problem.
Yes. Okay, that's we have to be united. Okay, Dr. Naziru, thank you, Dr. Zaki. Enough? Yeah, Dr. Naziru next. Thank you, Dr. Naziru.
Yeah, thank you, Professor. And you have a very nice house there, Professor. I like your backyard garden.
Jazakallah khair.
Yeah, thank you, Dr. Naziru.
Sorry, taking a bit too long. I mean, the talk almost an hour.
Yeah, okay, Dr.
I hope
Naziru.
wasn't boring.
Still muted. Please unmute. Okay. Okay.
Now, Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Yes, thank you very much. Barakallah fikum, Professor Sharif, for the presentation. I'm Dr. Nazir from Uganda, Islamic University in Uganda. I've attended and I would like to make this contribution. I've liked the presentation with examples from different fields, a lot of them from the surgery or surgical field. I don't know if that's because Professor is the surgeon himself. So my contribution is, how can we try to integrate the knowledge, disintegrate this knowledge of history of Islamic medicine by discipline, saying maybe the history of Islamic medicine, specifically to internal medicine, pediatrics, gynecology, such that we try to dig out into the history and the Muslim contributions in the different fields. And lastly, on how can we influence our medical colleges to make this part of their curriculum. For example, if someone is going to specialize in surgery, we make sure that part of the curriculum involves the contribution of the of the Muslim scholars in surgery. If someone is doing obstetrics and gynecology, we make part of the Muslim contribution to that discipline, part of the curriculum, beginning with the colleges that are actually founded on the Islamic principles or that belongs to the Muslim institutions. I thank you. That is the question.
Jazakallah khair. Akhi, this is very important question, by the way, really excellent. Yes, integrating this actually is a very, very important. The student, the junior doctors, they need to feel proud of their history, because if they feel the inferiority, they won't produce. They always feel they have almost nothing, no history, no roots. And the tree without great strong roots, it won't produce fruits, by the way. So yes, one of the way we're trying to do in the FEMA, Federation Islamic Medical Association, is we've created a project initiative called the History of Islamic Medicine, the HIM. And I mean, with a great humble, I'm taking this over. And we started producing many talks. So every probably maybe month, every 2 months, we have a talks. We have now probably maybe almost 10 talks, presentations, and we have a YouTube channels. And inshallah, I'll share this with Sister Fika as well. And we, for each subspecialty, whether in the medical side, surgical side, obs-and-gynae, we had a few. Try to educate ourselves. We learn from each other. We share experience, and that will be good resources to probably maybe teach ourselves every lectures before they go on the topic of obs-and-gynae, for example. It's good to see what happened to our history, so they can go through it very straightforward. Also, at the same time, we try to encourage people to write, to produce articles. We have a journal comes every 3-4 months, online journal for free. Everybody can submit, and it's accessed by anybody. And also, I'm going to send Sister Fika the link of the journal. There's a section on history of medicine, on different subspecialties. I think without learning, educating ourselves, it would be very difficult. There is some university, they do feel they're happy to produce academic courses. There is some, but again, end of the day, it comes to finance. If there's people willing to support this course, pay the fees, that's fine. But I think every medics need to have at least some minimum ideas on his or her specialties. You don't have to have a degree on the history of medicine. You only need to know the area you cover. But yes, education is the answer, I'm afraid.
Okay.
Jazakallah.
Jazakumullah khair. Okay, Professor, there is one other question that privately written to me, but I think Nadia is our student from State Islamic University. Nadia, you can ask yourself maybe. This is the last question, I think. Nadia, please.
All right. So, thank you so much, Dr. Fika and Professor Sharif, for the opportunity. So, good afternoon. I'm a third-year student here. Professor Sharif, I heard your explanation about the requirements for Muslim physicians to have recommendations or proof of good manners and ethics to apply as a physician. And I think this is a very interesting point. And I'm very curious on how this this requirement affect our code of conduct, the modern code of conducts of professionals now. And I would also like to thank for the very inspiring talk. I particularly really like the discussion about Muslim women's great contribution in the field of medicine. I find it to be very inspiring. Thank you so much, Professor Sharif and Dr. Fika.
Okay, thank you so much, Nadia.
Jazakallah khair. Sister Nadia, yes, two parts, your questions. Great. Number one, yes, I'm going to start with the status of female physician. There is an initiative started by female doctors called Dr. Maria Hussein. Maria Hussein, she's the head of the IMANA, the Islamic Medical Association of North America, and she gave a talk on the FEMA HIM program last time. I'm also going to send you the link of this on the status of Muslim females. Also, we produce a few articles on this issue. It is quite inspiring, and if you want to join, she's having focus group, subgroup for the people are interested in this. If you want to join, that's number one. The second question, yes, I mean, you are, mashallah, Indonesia is the biggest Muslim country in the world, and I'm sure the ethics actually is part, or supposed to be, or should be part of the code of conduct for physicians. I know in Kuwait they produce guidelines in early 80s, 1981 or 82. The organization of medical association in Kuwait, and they use the Muslim oath rather than the Hippocrates oath. And many of the Muslim countries, I know in some of the Middle East, they adopted this. So I don't think that's difficult. You need a bit of lobbying, and mashallah, there's a already published code of conduct for taken from the Islamic medical ethics, how the Muslim physicians need to be addressed and how to be part. We had a few presentations done on this as well, and we have the General Medical Council in the UK, and there's a people try to work it out, and obviously make sure we lobby, we have advocacy, but we live in a non-Muslim countries, so sometimes might be a bit difficult to influence euthanasia, for example. In Muslim countries, I don't think that will be big issue to put what Islamic medical ethics would say.
Okay, thank you, Professor. So actually, we have also seen ethics in Islamic views in our medical faculty. Most of our medical faculties background has Islamic background. So, but what you said is so different. Yeah, maybe because you based on the history. So I think because it's already 4:30, I think I will wrap up for the session. Professor Sarif, thank you so much, and don't be bored with our invitation. If one day we also want to invite you to anything about Islamic medicine, and
Inshallah.
I will wrap up that the tagline or take home message. The important one is the last one that you mentioned, that we need to learn history of medicine in our medical faculty and our professional life also, because it's important to know that to have to strengthen our belief and also our motivation that we need to embrace Islam in our practice. Yeah, maybe I think that's all for today's session. Thank you so much, Professor. And also thank you so much for all of the participants that have stayed until 1.5 hours. And for the last, maybe can we take a picture together? Can you open your
Sonali, give me the charger for my phone, please.
okay.
Sonali?
Okay. Anyone that can open your camera. We have two screen. So first one. 1, 2, 3. And second one. Stay smile. 1, 2, 3. Okay. 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 Thank you so much, Professor. Is there any anything that you want to close? What is it?
Jazakallah khair. Thanks very much.
Thank you.
We'll be in touch.
Yeah, we close this webinar by saying together Alhamdulillah, Alhamdulillahirabbil alamin. For me, thank you so much, and we'll meet again next month. Assalamualaikum warahmatullahi wabarakatuh.
Assalamu warahmatullah.
Thank you, Dr. Sharif.
You.
Warahmatullah.
I will have
Waalaikumsalam
your
warahmatullahi taala wabarakatuh. Thank you.
Barakallah.
Thank you, Dr.
Assalamualaikum.
Nasiru. Thank you all.
Jazakallah khair.
The Faisal.
Apologies from Prof. Junalis because trouble in internet in his room.
Yes, maybe next.
He cannot join because internet problem.
Okay.
Okay, thank you.
Thank
Terima
you.
kasih semua.
Terima kasih semua.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.